So when you join Memorial Sloan Kettering, what you want to do is expand the coverage of Memorial Sloan Kettering and make sure more people were able to get its services. What progress have you made so far in that?
I have wanted Memorial Sloan Kettering to be a cancer center to the world, both culturally, ethnically, and geographically. And there have been great efforts that have occurred, some of them before I got here. One of the efforts by our legislative team was to get our state to really drive managed Medicaid, managed care in New York to actually negotiate with Memorial Sloan Kettering so patients with Medicaid broadly could access this. We've had that law enacted, and patients now broadly are able to come to us. Our Medicaid service of patients is up by 63%. So number one, we now are getting a broader access of patients. Number two, we're partnering with hospitals across New York City. Jamaica Queens Hospital near JFK, which has a tremendously diverse population. The most diverse county in America is Queens. We're partnering with them to develop a cancer program. We also work with New York Hospital and Health and Services also for clinical trials and patients access at our Ralph Lauren Cancer Center. And we've developed a broad strategy around health equity that I think will further impact our city and our region for making sure everyone has access to the best cancer care in the world.
So as the head of Memorial Sloan Kettering Cancer Center, your biggest problem is getting enough money to do the research and give the patients the care they want. So you're always raising money, or that's not your biggest problem?
You know, it's not my biggest problem, but it is a problem. There's no doubt the cost in healthcare is significant, not only for our patients, but for the science and for the drugs. So it is a significant part of what I do is putting resources on the table so that our scientists, our clinical trialists, and our physicians are able to do their job and make discoveries.
So Memorial Sloan Kettering, what it does is it does research and then also does patient care.
Yes.
And there's an advantage, you would say, to patient care because you have people doing the cutting edge research?
Yes. Cutting edge research that's connected to doctors who are looking to answer questions as well as take care of people.
You also have students at Memorial Sloan Kettering. You have a graduate school for students, is that right?
Yeah, so the Gerstner School is really one of the outstanding biomedical graduate programs in the country that our students are focused in our labs largely on basic science and cancer research. We also have almost 2,000 fellows and residents who rotate through Memorial Hospital. So we have a robust educational program, although we don't have a distinct medical school, great graduate school, great training programs, nearly 100 different fellowships at Memorial.
Suppose somebody says they have a cancer that's, let's say, not a very good kind of cancer, not that any good not that any cancer is good, but suppose you have something that's very serious, stage 4 glioblastoma. The advantage of coming here is you can really make a difference at stage 4 for somebody?
Yeah, so the advantage of coming here broadly, so number one, the outcomes are different even at stage 1 for coming to a Memorial. At a stage 4, we certainly have the better chance of often prolonging life and having a chance to getting access to the most novel therapeutics with no guarantee that we're going to cure you, but we're going to give you every chance there is in the space of cancer to make a difference in your tumor.
So how does somebody become a patient? Somebody, let's say, walks off the street and says, I think I don't feel well, maybe I got a cancer. How do people get to be a patient here?
So number one, you can refer yourself and call, and we will help make that diagnosis. Or number two, your physician who you've seen as a primary care doctor can refer you here. Either way.
Suppose somebody says, I don't have any health insurance. What do you do?
We have services to take care of people who don't have financial ability.